The best way to describe that is basically walking a mile in my shoes. So being in somebody else's environment and trying to understand what it's like to live in their world and analyze that and get insights from that. And ethnography is not a new form of research, but it is new to how it's integrated into business to be used for market research. Good examples of past ethnography would be Jane Goodall in her work with gorillas in the mist and what came out of that. But she lived in their world and understood and tried to be a part of them, to really understand more of what their life is. When I worked at Harley-Davidson, another good example was that we would go to rallies, and part of our role as executives were to go to rallies, meet with riders, understand kind of what their needs are, what they like, what they don't like, and just really talk to them in their world, and understand more beyond what somebody could tell you in a survey. You could spend a day with somebody. I recently spent a day with the director of biomedical engineering at Children's Hospital and learned what it was like to walk in his shoes. They're the guys that fix the equipment when something goes wrong. So if you're in the middle of a surgery and something happens to any machine there, or they need something repaired, the biomed's the guy that goes there to fix it. They're not ones to ask for the respect, but they often don't get it. And we did a campaign called Biomed as Hero that really addressed them as the hero within their field, and it was a resounding impact. And so that was one day, and something that also didn't take a lot of budget.
Why did this approach elicit insights that some other methodology wouldn't have?
Good question. I find that most people have a hard time articulating what they want to say, what their motivations are, what their needs are. So to get that, you need to dig further. You need to try a methodology, a more qualitative methodology that gets at more context of their lives, to truly understand what needs aren't being met or what motivations they have. And you get some interesting stories. For example, Tammy, she learned the hard way. When she was first a nurse, one of the doctors said, push 50 cc of this med into this patient. It was an elderly patient. And what she heard was push, meaning get it in fast. So she put the medication in, and unfortunately, the patient coded at that point. The fortunate thing was that the patient survived, but she had the story to tell in terms of what she learned in the hospital on the job was so very different from what was taught to her in school. So, for example, the relationship between the doctor or the terminology that people use on the job, something that was very unique, and you learn that story, you learn something about that person that you wouldn't get in a survey. Knowing what was important also made a difference in what messages that we would use to market our programs, what's most important. In terms of getting the respect from the biomeds, as an example, was one. For the nurses, truly highlighting the key needs and motivations in terms of why are they a nurse to begin with, to really help them fulfill what they're trying to do for quality of care for patients. And that also bleeds into what our messages are. We had done many studies, many quantitative studies in the past that gave us a lot of the same information that we quite honestly anticipated we would get from the study. There was no new information from that. Based on that, we knew we wanted to understand more context to identify what new opportunities we could get into. Context of doing an ethnography would help us get more deep insight, more storytelling that we could actually get ideas from that we wouldn't have gleaned from any quantitative type of study or even an interview for that matter. Being in their homes during the game nights or being with them at the hospital when we were shadowing them really gave us an idea of what it felt like, what it meant to be them for those few hours. We got more nonverbal communication. They were at ease. The participants were at ease with us, and it was more of friends sharing information than it was a structured study, so to speak.